Hi, my name's Laura Coates and I'm a rheumatologist in the UK. This video has been produced by the Composition Study within GRAPPA, the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis, to help you as a dermatologist to spot signs of psoriatic arthritis amongst patients with psoriasis. We're particularly looking for arthritis, enthesitis and dactylitis, and today we're going to show you how to quickly examine for these different features of the disease and how to differentiate between inflammatory arthritis like psoriatic arthritis and other causes like osteoarthritis and back pain. The most common feature that we see in psoriatic arthritis is arthritis in the peripheral joints. This causes swelling and inflammation in the joints of the limbs, including the shoulders, elbows, wrists, fingers, hips, knees, ankles and toes. Psoriatic arthritis often affects the small joints of the hands and the wrists. Here you can look for swelling and inflammation around the wrists or the different joints in the fingers, and feel gently for a soft, boggy swelling. So psoriatic arthritis can also affect large joints like the knee, and here you want to again feel for swelling and look for swelling to look for inflammatory arthritis. This can cause pain, functional limitations in movement, and local increase in skin temperature over the affected joint, and occasionally skin redness. Swelling is the primary clinical sign of arthritis and can suggest thickening of the joint lining or fluid inside the joint. To assess for arthritis, I begin by asking the patient if they have any joint pain or swelling. If symptoms are reported, gently palpate the joint to feel for fluctuance, which suggests a fluid accumulation and joint swelling causing arthritis. So secondly, we look for enthesitis. This is where you get inflammation at the site where the tendons or ligaments attach onto the bone. It can happen at lots of different sites of the body, but it's probably most common to see in the heel, at the Achilles tendon and underneath the foot at the plantar fascia. To evaluate for enthesitis, ask the patient if they experience pain at any tendon or ligament insertion sites. Gently palpate the affected area, in this case the heel, just next to where the tendon attaches onto the bone, to detect localised tenderness, swelling or thickening at the enthesis. Often you may not feel swelling at the tendon insertion, but if this is significantly tender, it suggests the possibility of enthesitis. So the other key area to examine is the elbow. Obviously, as well as the elbow joint, there are two key sites where tendons from the forearm attach onto the elbow, and you can look for tenderness, swelling or thickening at these sites. And finally, dactylitis is swelling of an entire digit, a finger or toe, also known as a sausage digit, that's seen very typically in psoriatic arthritis. This is usually obvious to see on examination. You want to look at the hands and toes, and if there is uniform swelling visible through an entire digit, compare it to the other side for any obvious changes in size and shape between the two hands or the 2 feet. You can gently palpate along the length of the digit to confirm that the swelling is diffuse and throughout the whole digit, rather than swelling around the particular joints of the finger or toe. Arthritis and dactylitis in psoriatic arthritis can often be confused with osteoarthritis. One of the commonest other forms of arthritis is osteoarthritis that we see in patients with psoriasis, and it can affect exactly the same joints as it does in psoriatic arthritis. Typically in osteoarthritis, it affects the PIP joints and the DIP joints, as well as the base of the thumb. Whilst osteoarthritis can cause some soft swelling in these joints, it's more typical to be able to feel bony enlargement, a hard swelling where extra bone has formed, suggesting this is more likely to be osteoarthritis in the PIP and DIP joints. X-rays can also be helpful to differentiate between the two. Thank you very much for watching this video. We hope that this has been helpful to try and spot signs of psoriatic arthritis and understand which patients need referral on to rheumatology.